Hi, Joey Larada, Leatherman Spine. Talking today about cortical bone screws and the accuracy of placement using intraoperative stereotactic navigation. So this is a very similar study design to what we've already put out for freehand thoracic screws, robotic S2AI screws, freehand S2AI screws, and lumbar screws. The study design is exactly the same. We just applied it to cortical screws. These are disclosures, nothing that's pertinent here. Cortical screws have been recently introduced over the last 10 years as an alternative to pedicle screw fixation. Some studies suggest increased purchase in osteoporotic bone because of the cortical trajectory, but typically we insert these under fluoroscopic guidance. But using stereotactic navigation may allow us to decrease our radiation and improve our accuracy. This is a description of the way the screws are placed, superior medial aspect of the pars and aiming up and out. So the aim of the study was to evaluate what the accuracy of placing these screws with intraoperative navigation would be. We looked at 134 consecutive patients over a 2-year period, so 618 total screws, and the screw position and accuracy was assessed on both intraoperative or postoperative CT scans, whichever they had, using some software where you can change the gantry and look down the actual axis of the screw. This is a case example. This is what we're talking about, cortical screws. Average age of our patients in the cohort was 62. Average BMI was 32, which isn't actually that obese for Kentucky. Spinal pathology, as expected, degenerative spondylolisthesis was the majority, and the biggest level, or the most common level that we treated, was L4-5 with a 4-screw construct. And here's the kind of the meat and potatoes of the results. 608 of the 618 screws, over 98%, were placed without any breach at all, and there were only 5 screws that were placed with a greater than 1 millimeter breach. So in conclusion, cortical screws using intraoperative cone beam navigation is safe, it's reliable, its accuracy rate approaches 99%, the same for the navigation with other techniques, and despite 5 breaches, there were no major complications associated with them. Thanks.